good afternoon, or good evening. Hello, my name is Derek L. Forward, President of the Dayton Unit NAACP, and we are doing our monthly Dayton Unit NAACP Update TV show. I wanted to come on the show this morning, this afternoon, or this evening, to introduce someone special, and that is by ways of Chairlady Patrice Bell. She is our new Communications, Press, and Publicity Chair of the Dayton Unit NAACP. And she was introduced on our last show by our former chair, which was Carolyn Y. Perkins, who, by the way, did a phenomenal job, over the years that she served as the chair of our Communications, Press, and Publicity Chair. So I give Carolyn some kudos,
Yes.
For the job that she has done, over the years. So with that, I know we have some very important guests here with us today, and I'll let Chairlady Bell steal the show.
Thank you, President Forward, for that awesome introduction. Today we have joining us Ms. Cheryl Fleming. She's an HR manager at Greater Dayton Community Health Center, I'm sorry. And we also have Mr. Carlos Morrison, who is a certified application specialist at the Community Health Center of Greater Dayton. So I'll let you guys tell us about your position, and then we can get started.
I'm Carlos Morrison, Community Health Center, a certified application counselor, outreach worker. My position entails facilitating individuals who needed who were affiliated with the Affordable Care program to gain insurance, and also for those individuals who met the federal poverty criteria that would qualify them for the Medicaid extended program, which came under the law that was passed the latter part of last year to provide insurance. So I helped primarily to facilitate the application process online, as well as perform other outreach duties as assigned to me.
Okay. I'm the Human Resource Manager for Community Health Centers of Greater Dayton, and I'm also the supervisor for Carlos and our other two certified application counselors, Erin Mormon and Stacia Dawson. So I am their immediate supervisor in addition to my other HR duties.
And thank you both for being here today.
Thank you.
Thank you.
Before we get started with my questions, I want to take this time to bridge the gap, because some people say Affordable Health Care Act, some people refer to it as Obamacare. So let's call it what it is. Mm-hmm. We are all working to make health care affordable. And would you elaborate on exactly what the Affordable Health Care Act is and how people benefit from it?
Again, we have had a history within our country where a runaway high cost of medical costs has been kind of in a runaway pattern for a very long time. And although we're not the first nation that had medical coverage that the bill offered, this was the first opportunity that it was presented. And so there was two parts to the bill, and the first part entailed it covered individuals who could go up to 138% of the federal poverty guideline because everything was based on family size and income. So then there were individuals who could not afford that portion, and they had a Medicaid. It went under the Medicaid extended program, so anyone that met say, for instance, the family of one, it was 16,700 would have qualified them for the free insurance. For a family of two, it was 21,100. So it went on, so on and so forth. So it was based on family size and income. another portion of that was that if the individuals, what the family units consisted of, and so the salaried individuals helped to make that determination, and then how many individuals were used or were accounted as dependents. So basically, again, this was a program to assist the nation, not only to kind of stem the tide of the rising continuing medical costs, but to provide affordable health insurance for the individuals who may have come into a catastrophic situation, to make that affordable for everyone, not just those who could afford it.
Thank you, sir. Okay, now that we've bridged that gap on affordable care, we set the table for our discussion. How does a certified application specialist aid the communities to obtain health care or health insurance? What's the process?
Well, the certified application counselor is three basic things. One is to help raise the awareness. Two is to help facilitate the enrollment process. And three is to provide information on an impartial basis, because at some point one has to make a decision as to what plan that individual would go with. And in general, all of us, we always informed the customer that just to make sure that whichever plan that you did choose, and the plans are CareSource, United Health, Molema, Paramount, and Buckeye. Those are the major ones in Dayton. We informed them that to ensure them that they would make a choice with a clinic that was within the network of the ones that they were accustomed to. Well, basically, they come in and we sit down. It takes about 15 minutes to complete the process. The information is sent electronically to Job and Family Services, and they return, hopefully, it was a 30-day window initially, but it went to more than 30 days due to the fact that they were overwhelmed with applications.
With NAACP, we have fought very hard to ensure that the Affordable Care Act passed. We went all the way to Capitol Hill by ways of our director of our Washington Bureau, who also serves as our Senior Vice President of Advocacy and Policy, which is Hillary O. Shelton. We had an opportunity to go on Capitol Hill and meet with several legislators, to tell them about the extreme importance of the Affordable Care Act. Because as we look at the Affordable Care Act and what that means to the African American community, there's always those disparities that exist, whether or not it's healthcare, whether or not it's employment, whether or not it's education. But the job of the NAACP is to close the gap of those disparities. And healthcare was one of those disparities. When we think about HIV and AIDS inside of our community, it's running rampant. We need to make certain that we're on top of that, that people are getting covered or receiving the coverage that's needed to ensure that their lives are continuing to blossom. Then you're dealing with diabetes epidemic inside the African American community, and as well as what we used to hear about a lot. I haven't heard about it too much here lately, and that's sickle cell. Those are three diseases I know for sure that has plagued the African American community for years. Can you speak on that?
I can speak to it a little bit from the Community Health Center perspective, and that would also translate to the other federally qualified health centers here in Dayton. There's actually 3 of us. One of the things that we're required to focus on are quality outcomes.
Okay.
One of the issues that we do deal very strongly with is diabetes. A large proportion of our patients do have issues with diabetes. So part of our challenge as a health center and with the doctors and the nurse practitioners that are there is to have the individuals to continue to come into the health center on a regular basis, so that the doctors or the nurse practitioner or whoever's assisting them can help monitor that chronic issue. The issue that we have run into in the past with a lot of people were that they were uninsured.
Okay.
So in our case, we do take people who are self-pay. They may be uninsured, maybe on Medicare or Medicaid, but a lot of our patients, about 35% of them at one time were self-pay, meaning they didn't have any insurance. If you have very little income and no insurance, there is a challenge going to the physician on a regular basis, or there may be an additional challenge just to get the insulin to help with your diabetes, for example. So with the health care that's coming through, that's going to hopefully help us be able to see those patients, whether they have HIV, whether they have high blood pressure, whether they have diabetes. Another issue here in the community is infant mortality. And a high infant mortality rate within our community. If we can continue to see those patients, because now they have an ability to, I'm able to make that appointment. I can go to the doctor on a regular basis. I don't have to be concerned about how I'm going to pay for this because I'm already limited. That's going to be very helpful for the health of the community, and that is one of the things we monitor.
Okay.
Okay. Wow, it's powerful. To meet with you, Carlos, you or one of your coworkers to get the application process started, what does someone need to bring to their appointment?
Well, basically, they need to bring any financial information to include the previous income tax or pay stubs, recent pay stubs, and then that way we can calculate the yearly income. And then again, then all we need to do at that point is to look at the criteria and determine that they meet or don't meet. And I said prior to the 31st, and there were some that were in the hazy area in between. And because what we didn't want to do was to submit the application and have it rejected due to the fact that they made too much or too little. And so we paid special attention to ensure that we were able, and those documents were very important to assist us with that process.
Just going back to something you mentioned earlier regarding diabetes, I actually suffer from that illness. It's been inside of our family for a very long time. In fact, yesterday I was checking my my sugar levels, and they were extremely high yesterday. And a person like me who has insurance, through my company, while that's a good thing that I can go and get the medicine that I need, but for individuals who are uninsured, who are walking around with this disease, it's a very lethal disease if you don't treat it. So it's just very important that individuals who are not signed up for the Affordable Health Care Act, that they get signed up. And I believe the deadline has it already went by, or is that in July?
Well, again, we're trying to raise the awareness that for those who cannot afford insurance and do meet the guidelines, that's an ongoing process. The ACA portion of it was for more so for those individuals who could afford it, and what it did was really give them a wide variety of choices. Included that they had 4 levels, bronze, silver, gold, and platinum. And due to the fact that it was a federal subsidized process, individuals had to pick from a silver plan or higher. And so it got a little bit dicey in choosing, but the bronze was, of course, the cheapest. And again, what we saw was up to 30 choices to make that choice from. And the variables in the choices were the premiums, the deductible, and out-of-pocket. And those are the things that kind of determine, because it said the government subsidized money to either help assist the payment of the premium or to reduce the deductible to an affordable level, or to assist the out-of-pocket cost, or eliminate it totally.
So for the Affordable Care Act, there was an open enrollment.
Okay.
And that was October 1st of last year through March the 31st of this year. Just like anyone who's employed, you have an open enrollment
That's
time
correct.
frame. Anyone who did not enroll and was not able to take advantage of the expanded Medicaid because you may have had too much income, at this point would not be able to go into the marketplace for the Affordable Care Act unless there's some kind of a change in their status. So if they're working and maybe they had insurance but they've lost it for whatever reason, they've gotten laid off, whatever the situation is, those individuals may be able to go into the marketplace to purchase. Otherwise, the next enrollment period they're anticipating will be in October.
Following the approval of the health insurance, people can voluntarily enroll in a CareSource managed care plan. Can you explain what the MCP is and how people benefit from it?
Well, again, the MCP in general is just a health coverage, a comprehensive health coverage offered by one of the marketplace insurance agents. And as I said earlier, they are CareSource being one of them, United Health Care, Molina, Paramount, and Buckeye are the major insurers here in the Dayton metropolitan area. The Medicaid program would provide a card, a temporary card, once the application was approved from Job and Family Services. And then with that application response, they would ask the individual to contact one of those 5 to make a choice within, I believe it was 2 weeks. And then they would receive a permanent card from that particular insurer.
Okay. And how long does it take to know if you've been approved?
Well, that's where it got real dicey, especially at the end. Initially, we were telling them 30 days, and then we started to include 30 or more days. Near the end, we really emphasized the more days.
The more days.
Because as we got close to the 31st, we had some technical issues. The system got overwhelmed. And in one of our meetings with Job and Family Services, they were doing their very best to try to get those responses back within those 30 days. But as I said, it just got overwhelming at the end with the deadline.
Do you think that for the most part, in terms of, because we know that our president, President Barack Obama, he had wanted, in terms of to measure success, he wanted to enroll 7 million by that deadline, March 31st deadline. In fact, he was blessed to actually sign up over more than 8 million. Mm-hmm. Do you look at a push at the last moment? Because I know as we was monitoring it, it's saying 2 million, 2.3 million, mm-hmm. 2.6 million. Then it kind of gradually went up and up, mm-hmm. Until so I really think the deadline, that your system was probably overloaded throughout the country, mm-hmm. because people waited to the last minute, mm-hmm. to rush in there and get it done. Mm-hmm. Is that kind of what you all are seeing?
That, another good piece. Ms. Shaw, do you have?
Oh, I was going to say that's probably the biggest reason, and also the biggest reason for the extended wait time to get an answer back. People do tend to wait until they have to do something before they do it. So I think toward that last couple weeks, Carlos, Aaron, and Stacia, all 3 were very, very busy, mm-hmm. Trying to get as many people in to get enrolled before the deadline, mm-hmm. As they possibly could. So I think that's probably the biggest piece. Mm-hmm. I'm not sure what your experience, since we're past that 31st, has been in regard to getting people's mm-hmm. responses back, especially.
There was difficulty at the beginning too. There were a lot of technical issues and that could have taken some time away from the process, and it probably did, since I said we had a deadline. So we found out that we did lose a little bit of time in getting those applications, and we just sometimes resubmitted those to make sure that was corrected. as Michelle has said, that was basically procrastination at the end for the most part, just like the tax deadline came and went. But there are individuals who had their application not approved for one reason or the other. Another part that we do is try to minimally provide some guidelines when they have to appeal the process or resubmit that.
Is there anything that we didn't cover that you would need to inform the community about?
The greatest thing that I would recommend to the community is to raise the awareness that the process is still open for those who cannot afford it, and to please to contact the agency or to get in contact with any one of the other navigators to assist the process, because we've had phone calls from other outlying counties that go beyond Montgomery County. And those individuals, all we can try to do is assist them with what we know to direct so that they don't have to travel a long distance, but we have had out-of-county calls concerning that for the same assistance. So my response is to make the public more aware that it's still an open enrollment under the Medicaid Extended Program for those who meet that government guideline for what they determine as a poverty level.
Okay, and what's the contact information for someone to call your agency and to reach you or one of the other specialists? Counselors, I'm sorry.
The main number is 586-9733. That's 586-9733. My extension is 1031, and I believe Aaron is 1034, and Stacia is 1035. So 1031, 1034, or 1035, either one of us are available to assist that individual as quickly as possible to assist them.
And not only that, but Aaron, Stacia, and Carlos are also available to come out to any organization, faith-based organization, community organization, to share the same type of knowledge. That's also part of their job, is to do the outreach, to get people aware of this is out there for you. You may have passed the deadline for the ACA this time, but it's coming up again, to inform people what this is really about.
Now, when I think about the NAACP lobbying for this bill to pass on Capitol Hill, I think about how that's really been our plight for a number of years, and that is to help the less fortunate, to help those who cannot speak for themselves, to help those who have limited resources to fight for themselves. And so when I look at how we operate and the amount of time and work and effort that we put in from a national side, to ensure that any and all things that happen inside of our communities of colors. And when I think about communities of color, I think about a crayon box. And a crayon box tells me that that colors come in a variety of colors. Black, white, red, green, orange, yellow. So at the end of the day, the NAACP, when I think about civil and human rights, it's all about all people. But when I think about the courage of Mary White Ovington, who was the one who kind of formulated a group of people back in the early 1900s to found the NAACP, and it's because she felt, and she was a Caucasian lady, she the one who felt that that she was tired of seeing things that was happening to people of a darker shade than her. But she had the courage in the early 1900s to help found the NAACP. So when I think about us lobbying, so let me get back to that. When I think about us lobbying on Capitol Hill, and I think about all the people, 8 million or plus, 8 million and plus, who benefit from the work of the NAACP, because a lot of times people think, well, I'm not directly benefiting from the organization, so I shouldn't join the organization. I'm not directly benefiting. but you're having an indirect benefit from the organization, you know, either in years past or in years to come. And this is one of those years to come. Because of the work of the NAACP on Capitol Hill, fighting, lobbying throughout, you know, not just Capitol Hill, but all of us, you know, throughout the 2,200 units across this nation of the NAACP, was lobbying our state offices to ensure they really understood the importance of the Affordable Care Act. So with that in mind, what are the top 3 organizations inside of our community that has benefited financially from the Affordable Care Act?
That is a very good question. I'm not sure that at this point I could even answer that because we have just gone through the completion of the first round.
Okay.
I do know, on at least from our aspect, being the community health center, it is going to benefit us for a majority of reasons. We may see new patients. We may have a lower amount of people who are self-pay who now can come to the doctor, as I mentioned earlier, on a regular basis to get their continued coverage, including dental and anything else that they might need, behavioral health. So I'm not sure that we're at the point right now that we could really say that these are the 3 areas that are going to really monetarily benefit the most, but I think the whole community benefits.
Right. I mean, you know, one of the reasons why I asked is because like CareSource is expanding big time downtown.
Right.
And, you know, it looks like they're one of the beneficiaries of the Affordable Care Act as well.
Well, the all of them, I know at our Drew clinic, all of the main providers have come to provide information. But as I said, they have spread their, each one of them had their own unique. We have to be very objective in just providing guidance. And as I said, the key thing is to don't displace yourself. Don't displace yourself once you decide which one to go with. Stay within the network. And so, as I said, there's plus and minus in each one. So each one has, as I said, a different aspect to present to the consumer.
Okay.
So again, it's kind of, and I agree most heartedly that it's too early to tell who most benefit. There may be one that maybe leads a little bit or goes after the public a little bit higher, but again, the early bird catches the worm.
And the main thing is that the people benefit who need it.
Yes.
Okay.
Yes.
Okay. Mr. Morrison and Ms. Fleming, I want to thank you again for your time.
Thank you.
And to anyone that wants to connect to us, our office is located at 1528 West Dr. Martin Luther King Jr. Way. We're open Monday through Friday from 10 a.m. to 2 p.m. Our phone number is 937-222-2172. Our website is naacpdayton.org, and our Facebook page is Dayton Unit NAACP. We encourage people to like our page so we become more visible and people will know what's going on with us. Thank you and have a good day.
All right.
Okay.